everyone. Good morning. Good afternoon. My name is Upi Kriptoningrum. Welcome to the session with SIAP Consortium. My name is Upi Kriptoningrum and I will moderate this session. Our title is Improving Healthcare System Resilience through Collaboration and Exchange of Knowledge. Batiba, could you please share the slides also? Yes. We will be improving healthcare system resilience through collaboration and exchange of knowledge, leverage big data analytics to detect outbreaks and support real-time decision making. We have four speakers today, which will share the idea of SIAP, Sistem Informasi Awas Pandemi. This is a proposal we have submitted to the NWO Kemendikbudristek. We are now at the review stage of application about cooperation Indonesia and the Netherlands, resilient healthcare system for pathogen outbreak preparedness, and SIAP. We want to create SIAP platform, which is a platform for data integration and utilization to prepare the Indonesia and the Netherlands for the next pathogen outbreak. I will offer to Pak Lutfan. Please, Pak Lutfan. Pak Lutfan, you are muted. Unfortunately, Pak Lutfan, are you having me, Pak Lutfan? For SIAP Consortium, we have Dutch partners, which is AI and data science from Utrecht University, and EAES is the Industrial Engineering Innovation Space, TU Eindhoven, and also Eindhoven AI Institute from TU Eindhoven. And from the Indonesian partners, we have Health Policy Management from Gajah Mada University, Department Computer Science and Electronics, and we also have Pak Lutfan here.
Yeah. Sorry, I think I was disconnected. Can you hear my voice?
Yes, we can hear
Yeah.
you very well.
Yeah. So yeah, very good afternoon, ladies and gentlemen. It's really a great pleasure to be here. So my name is Lutfan Nazwarti from Gajah Mada University. So yeah, thank you Upi, for the introduction. So I just would like actually to mentions that we have a consortium involving the multidisciplinary expertise from Indonesia as well as the Netherlands. And yeah, I think through this event, we expect to expand this network, and we welcome also those of you who would like to participate on this projects. So our Indonesian sites involving academia, hospital, healthcare provider, as well as the company. So I think it's representing the multi-heric approach. And most of us already actually implemented the digital health projects on the real world, such as like the automated warning and alert system for the surveillance, as well as also the electronic medical record. So yeah, I think that's all. The probably short brief introductions from partner in Indonesian sites. Okay, so probably we can share to introduce this also. This is so far the expertise is that join with this network. We have the health policy and planning expertise. We have data scientists. We also have actually the expert from the rural side, which is I think very important also to be part of the consortiums, as well as also the project managers that will help during the course of the project timelines. And I will let Upi to introduce the Netherlands sites. You are muted. So.
From the Netherlands, we have several professors from TU Eindhoven and also from Utrecht University. We have Professor Tuche Martagan from OPAC Industrial Engineering, and she received many grants from NWO on projects related to healthcare, STEMI, and PD. Also, successful track record of real-world implementation of optimization models in collaboration with industry partners and generated real-world impact. They also recognized internationally with several professional awards, Informs in 2022, Informs in 2021 on Innovative Application of Analytics Award, also Applied Research Challenge First Prize. So many awards that I cannot mention all of them here. Also, the second one, we have Professor Joaquin van Schoren from TU Eindhoven. His research is focused on machine learning systems that learn how to learn all by themselves. He worked specifically on meta learning and automated machine learning. AutoML, he founded openml.org, an online platform for sharing data, code, models, and experiments on this subject. He also wrote books on this subject too. The third one, unfortunately, they could not be here today. Professor Yanis Velegrakis is a professor of computer science at Utrecht University, where he holds the chair of very large data management. He's also the head of Data Intensive Systems Group and the leader of the Masters in Data Science. Also a faculty member at the University of Trento and coordinator of the Data Intelligence Research Program. This research area of expertise includes big data understanding, social data analysis, knowledge discovery, big data management analytics, everything related to big data, and also data quality. Next year, he will be also chairing the ICDE 2024, that is International Conference on Data Engineering. The next one we have today here, Professor Jusong Lee from TU Eindhoven. Jusong uses data and AI to support decision making for real world problems. In this consortium, he will contribute in modeling and training of AI models. And last but not least, we have Daniel Kapitein. Daniel is fellow of Eindhoven AI System Institute. He helps companies to identify how to use AI, how to integrate this into business process, roles, and day-to-day operations. He's also academic director of professional education at YAP EC. Over to Pak Lutfan.
Yeah, thank you. So the next slide. So, well, as we know already that the COVID-19 pandemic has revealed the limitations of the healthcare systems, particularly in low and middle income countries, as well as in Indonesia. So the pandemic situations changes dramatically over time and throughout the country, and it's a challenge also the health system. Certain sorts of the patients overload the hospital, as well as paralyze the healthcare services. And furthermore, the medical capacity, such as the test kit, ICU, as well as vaccines, are very limited. In this case, the flexible and agile decision is necessary to respond to the pandemic, and of course that it will be better to be able to make decision precisely using the data. And from the pandemic, we learned that there is a need to improve the readiness level and the data quality, including also to use the big data that later on will be very useful to get prepared of potential pandemic in the futures, and it will also improve and strengthening the health system resilience. And there has been a lot of effort to improve further, including to speed up the digital transformations, such as that the Ministry of Health now have the projects called the Satu Sehat platform, with aims to, of course, adopt the technology to make the better improvement for the healthcare services. And to support this initiative, our consortium expected to work multi collaborations between um, various institutions to do the operation research involving many stakeholders as well as um, um, consortium that involving transdisciplinary approach in collaborations between the Indonesian and Dutch researchers. Next slide, please. So, so the aim of this proposed project is to improve the resilience of Indonesians' healthcare systems against the potential pandemics by preparing the quality healthcare data platforms and also to enhance the capacity of the medical professionals to manage the use of the big data. So there are several key specific objectives that will be presented further by Professor Yusong. We'll hand over this to Professor Yusong, please.
Uh, Hi, nice to meet you. I'm Jusong Lee. I'm assistant professor at TU Eindhoven in the Netherlands. So in SIAP project, we set 3 key objectives. The first key objective is to improve the quality of the data in the healthcare system. And for this, we will first identify the current systems and the processes in the Indonesia Health Information Exchange System. We are aware of the Satu Sehat, and it is collecting some data, but from our perspective so far, the global view of the collected data still needs to be assessed and reinforced to be really improve the resilience of our health system. And then we will assess the availability and quality of these data. And there are some techniques to evaluate the data quality and to supplement the missing data or the wrong data, because these data are often collected by different data generators. Sometimes it's not well organized, so we need some algorithm to do that. For example, Professor Vellakrakis at Utrecht University and Professor Van Skren at TU Eindhoven are experts in preparing data platform. Especially they work on the federated data platform. For example, Professor Van Skren is a core member of OpenML Group. OpenML Group provides the open data platform and analytics tools. And further, he can develop the algorithms to detect and resolve the common data quality issues like missing data or some other errors. And we are also planning to implement this to enhance the data quality of Indonesian health information exchange system. And furthermore, there is a one PhD position related to this topic we open. So this PhD position will be supervised in Utrecht University on the topic of the case study and engineering data platform SIAP. So the next key objective will be presented by Dr. Nia.
Thank you, Jisong. Okay. Hi, everyone. So my name is Kurnia Ningsi, or you can call me Nia. I'm from Department of Electrical Engineering, Politeknik Negeri Semarang. So our second objective is to develop data-driven tools that strengthen the resilience of the healthcare systems. So our focus areas here, first, pathogen outbreak detections and predictions. So by leveraging data analytics, we aspire to create tools that can seamlessly detect and predict pathogen outbreaks. Such tools can provide early warnings and enabling proactive measures. And our second focus area in this objective is supporting decision-making in the healthcare. So this tool aims to foresee healthcare needs and respond to them promptly. So think of it as a system that can anticipate and adapt, and also ensuring healthcare delivery remains smooth and even under stress. So there are several tasks that we plan to achieve this objective. First, identifying pandemic risk factors. So we know that the world is a complex web of interactions. So to preemptively tackle this health crisis, we are looking at multitudes of risk factors. So by understanding these factors is crucial in early intervention and prevention strategies developments. This may include like comorbidities, age, environmental factors, travel and mobility patterns, and etc. And the second task to achieve these objectives is we develop a multi-scale modeling. Why multi-scale approach? Because our health system deeply interlinked with human behaviors and environment. For a comprehensive understanding and actionable insights, we are developing multi-scale models. So this model operates spatially and temporarily. In these multi-scale models, we focus on creating surveillance systems. So this tool will keep an eye out for potential pandemics and give us early warnings. And the second focus in this multi-scale modeling is epidemiology modeling. So it will help us to simulate and understand how disease may spread in various scenarios. And the third task to achieve this object is harnessing machine learning. So by developing machine learning, we plan first to resource allocations. We aim to ensure resources like medical supplies or personnel or hospital beds are always optimally allocated. So whether anticipating a health crisis or responding to one, our system will be prepared. And the second is we develop machine learning for recommendation systems. So it will help decision makers by offering data-backed recommendations or suggestions and ensuring that the best possible choices are made in real times. So to build a healthcare resilience, to build a healthcare system that is resilient, we need to understand and navigate the intricate ties between humans, their behaviors, and their environments. With these data-driven tools and strategies, we are paving the way for a healthcare system that is not only robust, but also anticipatory and also adaptive. A system that is ready for whatever challenges the future may hold. Yeah, so that's the point in key objective 2. And now move to key objective 3 by Daniel.
Yes, thank you. Oh, can you hear me? No, you can't. Just checking. Can you hear me?
Yeah, we can hear you very well. Thank you.
Yes.
Sorry, you can hear me?
We can hear you. It's good.
Okay, because I don't hear anything. Yeah, sorry. So I'm Daniel, and I'm here to explain the key objective number 3. And basically, this work stream aims to provide a curriculum and develop a curriculum such that medical professionals in the field can confidently use all the tools that we developed in the previous work streams. And we all know, and I live in the Netherlands, it's actually quite hard to make such uncertain decisions, particularly in the pandemic situations. For example, when you have to decide for lockdowns and the like. So really, this data science curriculum that we aim to develop for medical professionals is really to aid them to have a good understanding about what data science and predictions can bring, but also what they can't bring, because ultimately it's up to persons, to professionals to decide what action to undertake. And based on our experience on teaching professionals at hospitals from the past years, we will develop this curriculum such that people, even with a non-technical background, know how to apply the tools that we are going to develop. And we do so by having a flipped classroom approach where we have a combination of online case studies, where people are really challenged in kind of simulation settings, given this data, what would you do? Given that data, what would you do? And that they actually learn how to deal with these uncertainties and grasp intuition of the underlying statistics. Part of this curriculum also relates to fostering a data culture within healthcare organizations. It's still something which is underdeveloped in most healthcare curricula. So that's also what we aim to provide in this program. And last but not least, I think for these type of real world implementations of data and AI, it really helps to share the different use cases, because the settings are often quite different and each context is also unique in that sense. So we've packaged all of that together such that we can develop a coherent curriculum to build the capacity of medical professionals going forward. So that's it from my side, and I think I'm handing over to Yusong.
Okay, so yeah, because this is international and multidisciplinary project, we involve Dutch partners and Indonesian partners. We have people from AI and data, from industry engineering and medical professionals as well. We need a good collaboration plans. So first, we have 2 PhD positions hosted in Dutch universities, TU Eindhoven and Utrecht universities. So we appreciate the field experience even for data scientists or data engineers. So we will dispatch these students to Indonesia for several times to learn from the real medical professionals in Indonesia and to identify the exact situations and problems there to help them. Also, there are 3 stakeholder engagement events are scheduled in Netherlands and Indonesia. The purpose for doing that is to hear the voice from the general public and other stakeholders such as policymakers and medical professionals. Also, at the end of this presentation, we have prepared some survey to hear your voice and to get idea how the people think about using the AI and data for the healthcare systems. And there will be several online communication and dissemination channels as well. So you will follow up later. And also intentional and online seminars and conferences will be prepared. And of course, the regular implementation and discussions will be happening as well. So if we go to the next slide. So because this is a research project funded by NWO, we of course expect some scientific impact. First, we aim to have the semantic matching for dynamic federal integrations. And we are also interested in federated data platform aligned with the IDS RAM4. And thirdly, we will gonna develop multi-scale models for pandemic preparedness and machine learning models for real-time decision support. All these things will be specialized for the situations in Indonesia, but at the same time, we aim to build the methodologies that can be beneficial for the other countries or other situations as well. So we want to claim this as our scientific contribution as well. And we will develop training modules for capacity building as well. As Daniel says, it's very important that the doctors and medical professionals can be used those tools and analysis platforms that we developed. So it's very important part of our contribution. And lastly, we will have the sustainability plans and roadmap for the implementation of the project outputs. Because this project aims for just only for a few years. We cannot do everything within our domain, but our goal is to suggest the blueprint or the future view of how it will go in the end. So that will facilitate the development of the better preparation of the pandemic. The impact to the society is quite clear for this project. We are proposing these new data-driven strategies for healthcare to improve pandemic preparedness. During the COVID-19, we already experienced some problems, and we have experienced some complaints as well. So I regard this as an opportunity because this allows us to identify many weaknesses of the current system, and we have a chance to improve their resilience and robustness as well. So we want to prepare for the future pandemic based on these lessons and based on the new approaches like data-driven methods. Also, we improve the capacity of health services by providing the data platform and predictive medical support. This not only implies delivering the technical systems and technical tools, but also to enhance the capability of the medical systems and medical professionals in using data and in applying the AI for their real works. And lastly, of course, we are building the long-term mutual learning culture of the Dutch and Indonesian researchers in multiple disciplines. As we have explained several times, we have a good, strong consortium composed of different disciplines. So we hope that this can be a good starting point to inspire each other in 2 countries. Yeah. So we are almost done in this phase, and as I said, it's really important for us. It's really important to hear your ideas and opinions and how it goes. How do you think about this kind of project? Because we are in the very beginning of this project. So we have prepared some interactive session using the Mentimeter. So please, audience, if you have phone or computer, you can go to the menti.com and you can use invitation code this one 41297234. So please have this have this in your phone or computers, then I'll share my screen to discuss together more interactively. So Upi, can I share my slide? My what is that? Can I share my screen?
Yes, you can share your screen. You use the present button.
Yes. Let's see. Do you see this?
Not yet. Okay.
Is it good? Yeah, the code was this. So if you put this code, you can get into this Mentimeter. So please have this in your phone or computer, and please participate and give us some feedback. What do you think about our project, and what's your idea about this kind of works? So I can share my screen. So this is a real-time online survey, so we can hear your voice in the real time. And if you have any questions or other comments, you can click this chat icon, then you can make some comments. So far we have no questions. And so this is SIAP project. We want to hear your voice in preparing for the next pandemic. So let's wait a few minutes to join the participant. And of course, this is on your own pace. So if you want to go to the next question, you can go, and you can also come back to the previous questions. So please submit the answers if you're willing to. By the way, how can I hear the questions from the audience? Can they chat in comments, or how does it work here?
I think there is one question from audience.
Okay, so let's start. We have 8 participants. So first, we want to hear who you are, what kind of job or positions that you are managing. So far we have 2 general publics and 1 medical professionals and 1 researcher and some students as well. It's nice. So this is just to hear what you who are you, and then the main question start from here. So let's think about our daily life, not just in pandemic, but in our daily life, like today or tomorrow. So the first question is that what data or AI tools do you use for healthcare nowadays? So nowadays we are living in really the big data environment, that all things around us are AI, data, and machines, electronic devices. So I want to hear like what is your perception about the healthcare, using the data and AI in the healthcare. So I see the smartphone is the biggest. Yes, I also use my smartphone and smartwatch, phone, website, web services. Nothing yet. It's quite interesting. Nothing yet. Okay. So this survey will be opened for a few more days. So if you are willing to participate more, or if you want to share it to your friends or colleagues, then you please do so. Then we will really appreciate your hearing. So smartphone is definitely the biggest, I think. And the second question is that what makes you excited to use the data and AI tools for the healthcare? So even as before becoming the, I myself is also the patient sometimes, and I'm the general public as well. So sometimes I'm quite excited to use my Apple Watch or the iPhone to track my health information and stuff. So the first question is what makes you excited about this? And actually, we also have the other question: what makes you hesitate to use the data and AI tool for the healthcare? So these 2 things that we want to hear you. So what makes you excited is mostly they say useful, helpful in decision making. Yeah. I'm quite curious, like what kind of decisions do you make using those AI and data tools? So if you there are some questions. So enter to mark essays. How can we struggle to perform surveillance using technology to mitigate an impending pandemic? Okay. So yeah, this is also one of the questions that we want to ask you in the later part of this survey. How can we struggle to perform surveillance using technology to mitigate an impending pandemic? So there are many challenges that we want to discuss. So like, for example, the first question starts from how to gathering the data and how to analyze this data. The main challenge that we are looking for is that those health data are usually collected by different data generators, and they are not really well organized. And sometimes there are many missing data. So that's the first challenge that we want to tackle. And you mentioned PhD position. Any requirements for applying this position? Yes, this is a bit general question, I think, because, for example, I'm working at TU Eindhoven, and to apply for the PhD position there, you have, of course, you need to have the required skill sets, as basic research skills, and also the data analysis skills and mathematics and programming. And also there are some more administrative requirements, something like you need to have the master degree in relevant area or something like that. And if you are really curious about this position, you can send me email, or soon we'll not soon. At some point we will announce the vacancy in our website, so you can check in TU Eindhoven or the Utrecht University, and you can check vacancies of the PhD positions. So let's go back to the sessions. So fast and informative, useful. And what makes you hesitate to use the data? Of course, the leaking data is central idea. Uncertainty, data security, data leaking, mostly the same thing. Privacy reasons, not valid information. Does it mean that, like, or is that the information that is given to you is not useful or wrong, something like that?
Perhaps other speakers can also comment on this. We open to discussion at the moment.
Sorry?
I think perhaps other speakers can also comment.
Okay, there is a question, yeah.
And I think this because it's open for discussion at the moment.
Yes, they were good. Can you share some insights on how difficult it is to get reliable real-time information and to provide reliable TA? Okay. I think it's quite difficult, but at the same time, throughout the COVID areas, we have built some good data collection infrastructures in different countries. For example, in the Netherlands, I think we have some apps from the health department, and also in Indonesia, I heard that there is a Satu Sehat. I'm not sure at this moment how it works exactly, but I heard that that's kind of real time, the data system based on the cell phones. Lutfan, can you explain a bit more about how Satu Sehat works and what do we expect?
Well, we in Indonesia actually have many health facility. We have more than 3,000 hospital with more than 11,000 primary health centers, and most of them. I think there are still a lot of proportions of the health facility still rely on the paper-based data collections. This is, of course, not easy then to get the real-time data. But there has been actually initiative from the Ministry of Health to implement the electronic medical record, which is actually, I think this is the first step to get the health data from the health facility. And it is expected that by this year, all of this health facility, of course, it is very optimistic, but it's really challenging to have these transformations from the health facility. This is just to show you that it's not easy to get the real-time data, which is expected then to introduce this electronic medical record will be the starting point to have the real-time information from especially healthcare providers.
Yeah, so Pak Lutfan, so the main focus you said is about challenging on data integration, right? So it's very challenging when we integrate medical data from different healthcare providers, right?
Yeah. But
So data integrations is one of the main challenging focus here to provide reliable real-time informations.
Okay, I hope that answers the question from Albert. So let's go to the next question. It's actually let's think about the next pandemic. So I asked the question, what did you complain the most about the healthcare system during the COVID-19? There are only 3 responses. Many different policies. Yeah, we really understand that. I think actually that this is also related to the question from Albert, because I think collecting data and integrating data is also really difficult, but at the same time, making the policies based on this data is even more difficult. And if we ask whether it's possible to do the real-time policy changes, it's difficult. And I'm also not sure whether that's really valid, right? Because I'm not sure about the Indonesian situation, but in Europe or in Korea, it's more chaos because if the policies are changing time to time.
Yeah, I think it's quite the same also that the regulations is changing well at certain sort of periods.
Mhm.
But I think the most probably intervention strategy during the pandemic is to limit the mobility, because I think this is also probably the interventions to somehow control the spread of the diseases.
Mhm. Yeah, I think also at this point, that's why we need the multi-scaling modeling and for the epidemiology and so on, because we want to predict what will be the impact if we change the mobility regulations. So we need to make more informed decisions on that.
Yeah.
The lack of
Perhaps I have a
Yes.
big question about the COVID-19 experience last years in Indonesia, because in the Netherlands it's a small country. It's perhaps it's easier to coordinate, collaborate, and I know that in the Netherlands, coordinated by the acute network of the Netherlands, and hospitals are working with each other. They have to submit the forms about how many beds do you have today, how many beds, how many patients coming. How about in Indonesia? Who was the coordination back then in the COVID period between the hospitals and then?
Opi, you are asking the coordination between the hospitals?
Yes, who was the coordination between the hospital? Are there any like hospital A, they don't have any beds, but hospital B, they have the beds. Can we send the patient to the other hospital with the COVID, or because that is in the Netherlands, perhaps because it's a small country, it's easier to coordinate. It's not easy, but there's not so many hospitals like in Indonesia.
I think there has been also the initiative to provide the informations about the bed, just for example. But of course, that many hospitals, I think, have a low capacity at the moment, since that they also the one that really influence of the pandemic. And I think there is a bad information, although probably maybe not really probably help the patients, because I think at the moment at that moment the information is maybe also not as good as when we when we are in the how to say, in the normal situations. In the normal situations, the information is also still not yet valid, and this will become worse in the pandemic situations. But there is an initiative to provide the information spot, including also the resources, the logistic as well.
Yeah. Thank you. And the next question is, what could be done by data-driven approaches in pandemic? So that's also related to the what we can do or what we should do. And besides, we have one question. We had one question here. How do I see that? I think the question was like, how does people not from data and AI to be involved in these kind of initiatives? Do we have this answer for this? How the people outside of the data and AI can be involved in this kind of project? I think the first thing that you can check off is our stakeholder engagement event. It's not yet scheduled, but I think you can participate that. And for more detailed perspective, I'm not sure how do you think about these questions. Daniel or Lufan, do you have any answer for that question?
So the question is the role of the non-data, right? If they would like also to be part of the projects. Yeah, I think well, we need the multidisciplinary expertise that not only on the data science side, but also include the health sectors, which is I think many audience is actually I guess also come from this these institutions, as well as like the health promotions and this promotion strategy would be, I think, the one that we needed also within this project, I think. So it's not necessarily have to be data scientists, but this is, I think, will be multidisciplinary approach that involving many expertises that I think will be play a role together also to achieve the main objective.
If I can add to that, in fact, one of the key starting points for this professional development curriculum is that we really want to demystify AI and data. And it really starts with the awareness that only when professional, in this case, healthcare professionals or social scientists, have a clear understanding about what the problem is that they want to solve, only then can data and AI be of help. But too often we see in failing data and AI projects, it's kind of a solution looking for a problem. And also in the way we develop and apply data and AI, there's a clear process guidance in different steps. And the first and foremost important one is what we call business understanding. If we don't know exactly what the problem is, there's no way data and AI is going to help. So, for example, algorithms are known to be very good at predicting stuff, but you need to be very precise as to what it is that you want to predict. And it can't be a fake or a hand waving something, I want to predict when the next wave is going to hit. That's too vague, but you need to make it very specific. Do I want to make prediction models at the regional level or at the hospital level or even at the village level? And then we can explore as to how data and AI can really help.
Good, thank you, Daniel. So the next question, it was about what should not be done or what could not be done by the data-driven approaches in pandemic. Privacy reasons, share data to the third parties. I think that's really related to the point that people hesitate to use the data in their personal health care in daily life as well. It's good. So the next question is, if pandemic policy is based on data and AI, how do you feel? Because as we mentioned several times, we are thinking to have a recommendation systems for policy during the pandemic. So I know that there is many concerns and as well. So we want to hear the voice from the audience as well. So the first one is too risky, I think, since we don't know what they will do with it using the data, and should be helpful, but it still needs good infrastructure and adaptation for our workforce. Yeah, we fully agree. So, well, we are not planning to replace the decision maker, but it's to support the decisions. That's why we call the recommendation systems. Maybe for the time reasons, I can go to the next one. So the final question that we want to ask is can you share the past experience in data AI implementation on real world problems? I don't have many answers for that. I think this is the last question that we have. Actually, I'm not sure how many audiences are here in this video conference.
Perhaps Mbak Nia or Pak Daniel can share the experience, the past experience with implementation of an application.
Yeah, okay. Yeah, so yeah, actually I ever worked with Pak Lutfans, yeah, experience in data AI implementation in real world. So we use climate change for 40 years, and we try to forecast the possibility of, yeah, actually same for pandemic at that time for malaria and malaria pandemic, right, Pak Lutfan? Yeah, so we can predict what factors in climate that will influence the pandemic of malaria. So endemic of malaria. Yeah. That's one of the experience in data AI implementation on real world, and the other experience, and also we analyze several factors that influence stunting, because stunting is also one of the biggest issue in the world and also in Indonesia, I guess, in the second health issue in Indonesia. So yeah, we develop many applications that can be useful for pregnancy women to avoid stunting. Yeah, maybe Pak Lutfan, you want to add more?
Just out of interest, what was the data that you used for this malaria case? What was the raw data for that?
Yeah, at that time we use Kemenkes, ya Pak Lutfan, ya, data from Kemenkes, the historical data for from the Kemenkes from all of province in Indonesia, and we try to predict and forecast the possibility of endemic malaria in the futures based on the climate change. So we try to predict the malaria endemic based on climate variabilities as well.
All right. Okay. Thank you.
Yeah, so it's basically combinations between the disease surveillance data with the environmental data, such as Nia mentions
Climate
the
variability.
climate data.
Yeah.
Yeah, I think this question is very interesting. In terms of the real world applications, there is still probably limited implementations in the large scales, but I'm very sure that there has been actually more maybe personal experience on using the AI with the limited settings. but I think a large scale implementation probably still limited somehow. But I'm very sure there are some that already implement this AI as well. Yeah.
I also have one question to Daniel, because we have so many experience in implementing the real world systems, and I want to hear some cases or challenges when you work together with the data scientists and domain experts, because from my personal experience, sometimes there is a conflict of the understanding the data, understanding the algorithms. And what kind of challenges did you experience, and how did you resolve that?
Yeah, so that's usually then. Thanks. It's a interesting question. I can give two examples. So in the setting of the Netherlands, we are now co-developing an algorithm based on a smart plaster. So it's a kind of a mini intensive care unit, but in the form of a plaster that you just put on a patient's chest. And that plaster measures your vital signs, 4 vital signs at a time frequency of once every 5 minutes. And the very simple idea is that if you do that, at the moment, everyone who is admitted to a hospital, and for example, in a post-operative state of where they run a high risk, a nurse needs to measure those vital signs every 3 hours, which is quite labor intensive. But furthermore, it also needs to be measured at night. So patients who are actually ill, who need to recover, need to be woken up to actually do so. So, from the outset, it seems almost trivial, like, oh yeah, this is going to work, right? Because we will have continuous measurements of these vital signs. But as you go along, it really boils down much more to things like design thinking, that we really have sessions with nurses as to what is your real problem and what is the real challenge and what it is that we want to predict. And after several discussions, it was only then that we found out, well, literally then someone said, if only we could know something like just an hour earlier that a patient is getting worse. Just 60 minutes earlier than usual, because if you do rounds every 3 hours, you stand a chance you actually miss the time window that a patient actually deteriorates. And that was actually a key moment, because then we knew, now we know what we need to ask of the algorithm. It's just a time window of 60 minutes. And then from then on, we can actually start working and say, okay, which of these predictors can actually do that? But at the same time, also immediately think of, okay, even if this algorithm isn't managed to give an early warning sign, as we call it, what is it that we're going to do? Because you already can start thinking about amending the protocols in the hospitals. For example, a doctor needs to come, or we need to do extra tests to make sure that we prevent worse from happening. So that's one example. I really believe that we need this design thinking process from the very start. And that's often more labor intensive than just the algorithm itself.
Okay.
So that's one example. I'm just a bit confused. I'm not sure whether that chat in the comment is for ours or for a different stream. It seems like it's for a different stream, right? So that's one example in the Netherlands. I have another example. I do a lot of work in low and middle income countries, particularly in Africa. And what I see happening there in the sense of data and AI is really handheld devices that can more or less replace doctors for diagnostics. So think about mobile X-ray scans, think about mobile retinal scans, think about mobile ultrasound for pregnant women. And these devices are now so optimized, and also often a smartphone is the main computing engine. That really opens up many possibilities that you can at least do diagnostics remotely. And only if there's enough reason based on that diagnostic that you actually ask patients to sometimes travel 1 or 2 hours when there's really a need to, rather than, oh, I don't feel well and I'm going to travel and even lose my income for a whole day. And because AI has been proven to be very robust at very narrowly and specifically defined diagnostics tasks, that's where I see a lot of opportunity, and possibly also in the case of pandemics and surveillance. So one of my colleagues, he's active also in Africa. He says we need to think about deploying more tests which are relatively cheap, also for pandemics. And even if the accuracy of a test is not that good, for example, we would not allow it in a Western market. Having many of those tests and then you can bootstrap it with statistical techniques will provide you better insight into the spread of pandemics. And he put this case forward for HIV testing. There are very, very cheap HIV tests, which are not brilliant in terms of accuracy, but if you do loads of them, they can actually help to gather data for pandemic responses.
Thank you, Daniel, for sharing the insights. Yeah, it was really insightful because I think that what you just, the two stories that you tell is also connected to your first sentence that we need to be very specific what to ask to the data. Yeah.
Yes.
Okay. For the time purpose, I think we can close the session here. Upik, can you summarize and close the session? Thank you for every participant to completing your survey, and we really appreciate your contributions.
Yeah, thank you for all the speakers. We have heard the ideas of SIAP consortium, how to prepare the next pandemic with data analytics. A lot of challenges, a lot of things that need to be done, infrastructure, culture, a lot of collaboration. I think that's something that will also leverage and strengthen the health system. And we also excited if we could go to collaborate between the Netherlands and Indonesia on this subject. Any additional comments, everyone, from the speakers?
I think it's enough.
Yeah, it was enough. Yeah. We had 10 participants for our survey, so I really appreciate them. Thank you.
Yeah. Thank you all for joining this session, and we wish you all a nice next day on the last day on the winner session. And thank you for all the speakers for the time that you spent here sharing our ideas.